This profound observation beautifully encapsulates the journey we are all on, especially as we navigate the later chapters of life. It challenges us to view the changes that come with age not as declines, but as transformations, each bringing its own unique set of experiences and, yes, sometimes its own unique set of physical realities. Today, we're going to delve into a topic that, while common, is often met with quiet frustration: the appearance of cysts and blackheads in our elderly years. This isn't just about superficial skin concerns. It's about understanding our bodies, maintaining comfort, and nurturing our confidence as we age gracefully. Before we dive deep into understanding and managing cysts and blackheads in the elderly, if you're looking for a community dedicated to embracing every stage of life with wisdom, joy, and practical strategies, make sure to hit that subscribe button right now on Aging Gracefully 60. We're here to guide you through the journey of aging, not just gracefully, but powerfully. One of the most common and often exasperating skin issues many individuals over 60 encounter is the persistent presence of blackheads. Perhaps you've noticed them, seemingly appearing out of nowhere, often clustered around the nose, forehead, or chin, but sometimes spreading to other areas of the face and even the back. It's a reality many of us face, and it can be quite disheartening. We often associate blackheads with teenage years, a tumultuous period of hormonal shifts, and assume they should fade with age. However, the truth is that our skin continues to evolve, and with these changes come new challenges. The skin's natural oil production, while it may decrease overall, can become less balanced, leading to sebaceous glands producing oil that is thicker and more prone to clogging pores. Furthermore, the rate of cell turnover, which is how quickly our skin sheds old cells and replaces them with new ones, significantly slows down as we age. This slower turnover means that dead skin cells linger on the surface for longer, accumulating and mixing with sebum and debris to form those telltale dark plugs. Think about how this might apply to your own life. Perhaps you've maintained a diligent skincare routine for years, only to find these unwelcome visitors making a comeback. The feeling of rough, congested skin, the visible dark spots, and the sometimes uneven texture can certainly impact one's self-perception and comfort. It's not merely a cosmetic concern. These blocked pores can also become inflamed, leading to more significant breakouts or even discomfort. The lack of proper exfoliation and the changes in skin elasticity, which make pores appear larger and more open, contribute to this frustrating cycle, making it harder for the skin to naturally clear itself. Doesn't that resonate with you, the feeling that despite your best efforts, your skin isn't behaving as it once did? The antidote to persistent blackheads in our later years lies in a multi-pronged approach that focuses on gentle yet effective cleansing, exfoliation, and hydration, tailored specifically for maturing skin. The first crucial step is to reevaluate your cleansing routine. Harsh, drying cleansers that might have been suitable in younger years can strip the skin of its natural moisture barrier, paradoxically encouraging more oil production and further congestion. Instead, opt for a mild, hydrating cream or gel cleanser that effectively removes impurities without causing irritation. Cleansing twice daily, in the morning and before bed, is essential to remove accumulated oil, dirt, and makeup. Beyond cleansing, targeted exfoliation is paramount. While physical exfoliants with harsh particles can be too abrasive for delicate, aging skin, chemical exfoliants, particularly those containing salicylic acid, a beta-hydroxy acid or BHA, are incredibly effective. Salicylic acid is oil-soluble, meaning it can penetrate deeper into the pore lining to dissolve the sebum and dead skin cells that form blackheads. Look for toners or serums with a low concentration of salicylic acid, around 0.5% to 2%, and introduce them gradually into your routine, perhaps 2 to 3 times a week, observing how your skin responds. Imagine the difference this could make, gently clearing your pores from within. Another vital strategy is consistent, lightweight hydration. Even oily or combination skin needs moisture, and a well-hydrated skin barrier functions more optimally, helping to regulate oil production. Choose a non-comedogenic moisturizer, one that won't clog pores, and apply it after cleansing and exfoliating. Furthermore, protecting your skin from sun damage is often overlooked in the context of blackheads, but UV radiation can thicken the skin and impair its natural shedding process, worsening congestion. Daily use of a broad-spectrum sunscreen with an SPF of 30 or higher is non-negotiable. Finally, while tempting, resist the urge to squeeze or pick at blackheads, as this can lead to inflammation, infection, and even scarring. Regular, gentle professional extractions by a dermatologist or esthetician can be a valuable addition to your routine if home care isn't sufficient. It's a simple truth, isn't it, that a consistent and gentle approach often yields the best results for mature skin. Beyond the familiar blackhead, many seniors also encounter milia, those tiny, pearly white or yellowish bumps that frequently appear on the face, particularly around the eyes, cheeks, and nose, but can also manifest on other parts of the body. Unlike blackheads, which are open comedones, milia are closed, trapped pockets of keratin, a protein found in skin, hair, and nails, that have become lodged just beneath the skin's surface. They often feel hard to the touch and can be quite stubborn, not responding to typical acne treatments. This can be particularly frustrating because, while harmless, their presence can affect the smoothness and overall appearance of the skin, leading to a feeling of unevenness or a rough texture. Perhaps you've felt this too, these tiny, hard bumps that seem impervious to your usual skincare efforts. The underlying causes of milia in the elderly are varied. One significant factor is the natural slowdown of the skin's exfoliation process. As we age, the cellular turnover rate decreases, meaning that dead skin cells are not shed as efficiently, creating an environment where keratin can become trapped. Additionally, chronic sun exposure over many years can contribute to the formation of milia, as UV damage can thicken the outer layer of the skin, making it harder for the skin to naturally shed its cells. Certain heavy or occlusive skincare products, particularly those with rich emollients that are not well suited for your specific skin type, can also inadvertently trap keratin and contribute to their development. Furthermore, certain medical procedures like dermabrasion or laser resurfacing, or even some chronic skin conditions, can sometimes trigger their appearance as the skin heals. The feeling of these persistent little bumps, often resistant to home remedies, can be quite bothersome, impacting one's sense of smooth, clear skin. Addressing milia in the elderly requires a targeted and gentle approach, focusing on encouraging cell turnover and, when necessary, professional intervention. The first step involves re-evaluating your skincare products, particularly moisturizers and sunscreens. While hydration is crucial, opting for lighter, non-comedogenic formulations can prevent further trapping of keratin. Look for products labeled oil-free or non-comedogenic. Gentle chemical exfoliation can also be beneficial in the long term, helping to promote healthier cell turnover. Alpha-hydroxy acids, AHAs, like glycolic acid or lactic acid, in mild concentrations, can help to loosen the bonds between dead skin cells, allowing them to shed more effectively. Introduce these gradually into your routine, perhaps 2 to 3 times a week, to avoid irritation. Doesn't that resonate with you? The idea of gently coaxing your skin to renew itself. However, it is crucial to understand that milia cannot typically be squeezed out like blackheads, as they are enclosed cysts. Attempting to do so can lead to skin damage, infection, and scarring. The most effective and safest method for removing milia is often through professional extraction. A dermatologist or a trained esthetician can use a sterile needle or lancet to create a tiny opening in the skin overlying the milia, and then gently extract the keratin plug. This is a quick and relatively painless procedure that should only be performed by a qualified professional to ensure safety and prevent complications. Regular facial steaming can also be a helpful preparatory step, as the warmth and moisture can help to soften the skin, potentially making exfoliation and future professional extractions more effective, though it won't resolve existing milia on its own. Imagine the difference this could make, achieving that smooth skin texture you desire with expert care. It's a simple truth, isn't it, that sometimes the best solutions come from combining diligent home care with professional expertise. As we age, another common skin concern that can manifest is the development of sebaceous cysts. These are non-cancerous lumps that typically form just under the skin, often feeling like a small, movable sac filled with a cheesy or oily material. They can appear anywhere on the body, but are most commonly found on the scalp, face, ears, trunk, and groin. While often painless and benign, Their presence can be a source of significant discomfort and aesthetic concern for individuals over 60. Perhaps you've noticed a persistent lump that just doesn't seem to go away, causing an underlying sense of worry. The formation of a sebaceous cyst occurs when a sebaceous gland, which produces the skin's natural oil, sebum, becomes blocked or damaged. This blockage can be due to a variety of factors, including trauma to the skin, a surgical wound, or a genetic predisposition. When the duct of the gland becomes obstructed, sebum continues to be produced but has no outlet, leading to a buildup that forms the cyst. As we age, our skin's elasticity and resilience decrease, and the risk of minor traumas or blockages may increase, contributing to their appearance. The impact of a sebaceous cyst goes beyond mere aesthetics. Depending on its location and size, it can become irritated by clothing, shaving, or even simply lying down. If it ruptures internally, it can lead to inflammation, pain, and the risk of infection. Furthermore, a ruptured or infected cyst can be quite tender, swollen, and red, requiring medical attention. The uncertainty of what the lump might be, even if it's usually benign, can also cause anxiety, leading to frequent self-checks and heightened awareness of its presence. It's a reality many of us face, wondering about these unexpected growths on our skin. Managing sebaceous cysts in the elderly primarily revolves around careful observation, conservative home care for non-problematic cysts, and professional medical intervention when they become bothersome or complicated. For small, uninfected, and asymptomatic cysts, a wait-and-see approach is often recommended. It's important to avoid picking, squeezing, or attempting to drain a sebaceous cyst yourself, as this can easily lead to infection, rupture, and subsequent inflammation, making the situation much worse. Gentle warm compresses applied to the cyst for 15 to 20 minutes, several times a day, can sometimes encourage drainage if there is a tiny opening, but this is rare and should not be relied upon as a primary treatment. The warmth can also help reduce inflammation if the cyst is already a bit tender. The key is to keep the area clean and dry to prevent secondary infection. Imagine the difference this could make, alleviating discomfort with gentle care. However, if a sebaceous cyst becomes enlarged, painful, inflamed, infected, or is in a location that causes persistent irritation, medical attention is necessary. A dermatologist or general practitioner can accurately diagnose the cyst and recommend the most appropriate course of action. The most common and definitive treatment for a problematic sebaceous cyst is surgical excision. This involves a minor surgical procedure where the entire cyst wall is removed to prevent recurrence. If the cyst is infected, a doctor may first drain the pus and prescribe antibiotics before performing the excision. In some cases, if the cyst is small and uninfected, a doctor might opt for an intralesional injection of corticosteroids to reduce inflammation. It's a simple truth, isn't it, that while many skin changes are benign, expert medical evaluation provides peace of mind and effective solutions. Distinct from sebaceous cysts, pilar cysts are another common type of skin growth that can affect individuals over 60, particularly those with a family history of them. These cysts primarily occur on the scalp, often appearing as smooth, firm, flesh-colored bumps that can range in size from very small to several centimeters. While they are usually benign and often painless, their presence on the scalp can be a source of considerable annoyance and concern. Perhaps you've noticed a persistent lump on your scalp that you can feel when you brush your hair or wash it, causing a subtle but nagging discomfort. The origin of pilar cysts lies in the hair follicle. They develop from the outer root sheath of the hair follicle, and unlike sebaceous cysts, they are filled with keratin, but a different type of keratin that is more paste-like or granular. The exact cause of their development is not fully understood, but there is a strong genetic predisposition, meaning if your parents or grandparents had them, you are more likely to develop them too. As we age, the cumulative effects of hairstyling, brushing, and minor traumas to the scalp can potentially contribute to their formation or irritation. The impact of pilar cysts, while generally not medically serious, can be significant from a daily living perspective. They can become quite large and noticeable, leading to aesthetic self-consciousness, especially if hair thins around the area. They can also be painful or tender if they become inflamed, infected, or rupture. Brushing hair, wearing hats, or even sleeping can become uncomfortable if a cyst is located in a pressure point. The feeling of these firm, sometimes growing lumps on the scalp can certainly lead to a sense of unease and a desire for resolution. It's a reality many of us face, these silent bumps that can affect our daily comfort. The management of pilar cysts, much like sebaceous cysts, primarily involves careful monitoring and, when necessary, professional medical intervention. For small asymptomatic pilar cysts, no specific treatment may be required, and a watch-and-wait approach is often recommended. It is vital to avoid attempting to drain or rupture these cysts at home, as this can lead to infection, significant inflammation, and an incomplete removal, which increases the likelihood of recurrence. Maintaining good scalp hygiene, though not a preventative measure for cyst formation, can help prevent secondary infections if the skin over the cyst is compromised. Think about how this might apply to your own life. Gentle washing and avoiding harsh scratching of the scalp can contribute to overall scalp health. However, if a pilar cyst becomes large, causes discomfort or pain, becomes inflamed or infected, or is simply a cosmetic concern, surgical removal is the most effective and definitive treatment. This is typically a straightforward outpatient procedure performed by a dermatologist or general surgeon under local anesthesia. The surgeon makes a small incision over the cyst and carefully excises the entire cyst wall, which is crucial for preventing recurrence. In cases of infection, the cyst may first be drained, and antibiotics prescribed before complete removal can be performed. Sometimes a technique called punch excision is used, especially for smaller cysts, which involves removing a small circular piece of skin containing the cyst. This method often results in a smaller scar and quicker healing. Imagine the difference this could make, relieving the discomfort and restoring peace of mind. Regular checkups with your doctor or dermatologist are also important, as they can monitor any existing cysts and address new ones as they appear, ensuring that any changes are promptly evaluated. It's a simple truth, isn't it, that embracing professional care for these common skin issues ensures both health and comfort in our later years. While often associated with adolescence and young adulthood, hormonal fluctuations continue to play a significant, albeit different, role in our skin health as we age, impacting the predisposition to issues like cysts and blackheads. For women, the dramatic decline in estrogen during menopause, and for men, the gradual reduction in testosterone and androgen levels, can lead to noticeable changes in skin composition and function. This isn't just about wrinkles. It's about the very physiology of our skin. As estrogen levels drop, the skin tends to become drier and less elastic. But paradoxically, some individuals experience a resurgence of acne-like breakouts, including blackheads and even cystic lesions. This seemingly contradictory phenomenon occurs because while overall oil production might decrease, the ratio of hormones can shift, leading to an increase in relative androgen activity. Androgens can stimulate sebaceous glands, leading to an increase in sebum production, which may be thicker and more prone to clogging pores. Furthermore, the skin's natural barrier function can be compromised, making it more susceptible to inflammation and bacterial imbalances, which are precursors to breakouts. Perhaps you've felt this too, a feeling of adult acne reappearing when you thought those days were long behind you. For men, while hormonal shifts are more gradual, changes in testosterone and dihydrotestosterone, DHT, levels can still influence sebaceous gland activity and skin texture. The overall thinning of the epidermis and dermis also means that blocked pores are less efficiently cleared, and inflammatory responses can be more pronounced. The frustration stems from the unexpected nature of these breakouts and the feeling that your skin is regressing, rather than maturing gracefully. This hormonal interplay can lead to a sense of unpredictability in your skin, making it harder to establish a consistent and effective skincare routine. Managing hormonally influenced cysts and blackheads in the elderly requires a holistic approach that considers both topical skincare and, in some cases, internal support or medical consultation. The first line of defense is a consistent, gentle skincare routine that respects the unique needs of aging, hormonally changing skin. Focus on non-comedogenic products to prevent further pore clogging. Incorporating gentle chemical exfoliants such as AHAs like lactic acid or low concentrations of BHAs like salicylic acid can help promote cell turnover and keep pores clear. Unlike the higher concentrations used in younger skin, gentle formulations are key to avoid irritation on more delicate mature skin. Think about how this might apply to your own life. Gradually introducing these ingredients can make a significant difference. Hydration is also paramount. Even if breakouts are occurring, dehydrated skin can worsen the problem, as it can lead to overcompensation in oil production. Use a lightweight, non-comedogenic moisturizer to maintain a healthy skin barrier. For women experiencing significant menopausal acne, discussing hormone replacement therapy, HRT, with a healthcare provider might be an option. While not solely for skin, HRT can address overall hormonal balance, which may indirectly improve skin health and reduce breakouts. This decision should always be made in consultation with a doctor, weighing the benefits and risks. For both men and women, dietary considerations can play a role. Some studies suggest that a diet high in processed foods, sugar, and dairy might exacerbate hormonal imbalances and inflammation, potentially contributing to breakouts. Focusing on a balanced diet rich in fruits, vegetables, lean proteins, and healthy fats can support overall skin health. Stress management techniques such as mindfulness or yoga can also be beneficial, as stress hormones can influence sebum production. Imagine the difference this could make, a comprehensive approach that nurtures your skin from within and without. It's a simple truth, isn't it? That understanding the intricate connection between hormones and skin allows us to age gracefully and confidently. While genetics and age-related changes are significant contributors to skin issues like cysts and blackheads in the elderly, various lifestyle factors can either exacerbate or mitigate these concerns. It's a reality many of us face, where daily habits subtly influence our skin's resilience and clarity. Poor dietary choices, for instance, can lead to systemic inflammation, which directly impacts skin health. A diet high in processed foods, refined sugars, and unhealthy fats can trigger inflammatory responses in the body, which in turn can stimulate oil glands and worsen conditions like acne and contribute to clogged pores. Furthermore, inadequate hydration is a widespread issue among seniors. When the body is dehydrated, the skin suffers. Its barrier function weakens, and it becomes less efficient at shedding dead skin cells, making it more prone to blackhead formation and general congestion. Stress, a silent epidemic, also plays a crucial role. Chronic stress elevates cortisol levels, a hormone that can increase sebum production, making the skin more susceptible to breakouts and irritation. Perhaps you've felt this too, the way a particularly stressful period seems to manifest on your skin. Lack of consistent sun protection is another critical factor. Years of cumulative sun exposure can thicken the outer layer of the skin, hyperkeratosis, and impair its natural exfoliation process, leading to clogged pores and a rougher texture. It also degrades collagen and elastin, affecting pore structure and making them more prone to trapping debris. Finally, the use of certain cosmetic products or even laundry detergents that are irritating or comedogenic, pore clogging, can directly contribute to skin problems. The feeling that your efforts are undermined by unseen factors can be disheartening. Optimizing lifestyle factors is a powerful, often overlooked strategy for preventing and managing cysts and blackheads in the elderly. The first and most impactful step is to embrace a skin-friendly diet. Focus on whole, unprocessed foods, abundant in fruits, vegetables, and lean proteins. Incorporate omega-3 fatty acids from sources like fatty fish, flax seeds, and walnuts, as these have anti-inflammatory properties that can significantly benefit skin health. Limiting sugary drinks, refined carbohydrates, and excessive dairy can also reduce inflammation and potential breakouts. Think about how this might apply to your own life. Making gradual, sustainable dietary changes can yield surprising benefits. Adequate hydration is equally crucial. Aim to drink plenty of water throughout the day, recognizing that thirst cues can diminish with age. Herbal teas and water-rich foods like cucumbers and watermelon can also contribute to your daily fluid intake, supporting your skin's ability to function optimally and shed cells efficiently. Stress management techniques are another vital component. Incorporate practices like meditation, deep breathing exercises, gentle yoga, or spending time in nature into your daily routine. Reducing stress can lower cortisol levels, thereby lessening its impact on your sebaceous glands. Consistent and proper sun protection is non-negotiable. Daily application of a broad-spectrum sunscreen with an SPF of 30 or higher, even on cloudy days, is essential. Additionally, wearing wide-brimmed hats and seeking shade during peak sun hours will protect your skin from harmful UV radiation that contributes to skin thickening and pore clogging. Finally, scrutinize your personal care products. Choose non-comedogenic makeup, moisturizers, and sunscreens, and opt for gentle, fragrance-free laundry detergents to minimize skin irritation and allergic reactions. Imagine the difference this could make: a holistic approach that supports your skin's health from the inside out. It's a simple truth, isn't it, that nurturing our bodies with conscious lifestyle choices profoundly impacts the clarity and vitality of our skin? While home care and lifestyle adjustments are foundational, many seniors find themselves facing persistent or complex skin issues like cysts and stubborn blackheads that warrant professional dermatological attention. It's a reality many of us face, that some skin concerns require more than over-the-counter solutions. One of the primary challenges is recognizing when a skin issue transcends minor self-care and truly needs expert evaluation. Perhaps you've tried various cleansers, exfoliants, and dietary changes, only to see minimal improvement, or perhaps a new, unusual lump has appeared, causing worry. The feeling of uncertainty about a skin growth, the discomfort of an inflamed cyst, or the sheer frustration of chronic blackheads that impact self-confidence can be immensely taxing. Furthermore, as we age, our skin becomes more delicate and susceptible to complications from improper self-treatment. Attempting to forcefully extract blackheads or drain cysts at home can lead to skin damage, scarring, secondary infections, and prolonged inflammation. There's also the critical concern of accurate diagnosis. What might appear to be a benign cyst or blackhead could, in rare cases, be something more serious, such as a precancerous lesion or a skin cancer. The average person lacks the medical knowledge and diagnostic tools to differentiate between these conditions, leading to potential delays in critical treatment. It's a simple truth, isn't it, that for complex or concerning skin issues, self-diagnosis and self-treatment carry significant risks. The most effective solution for persistent, problematic, or concerning cysts and blackheads in the elderly is the timely consultation with a qualified dermatologist. A dermatologist possesses the specialized knowledge and diagnostic tools to accurately identify the type of skin lesion, rule out more serious conditions, and recommend the most appropriate and effective treatment plan. For stubborn blackheads, a dermatologist can perform professional extractions safely and effectively, minimizing the risk of damage and inflammation. They can also prescribe stronger medical-grade topical treatments containing retinoids or higher concentrations of salicylic acid that are more potent than over-the-counter options, but are carefully monitored for tolerance on mature skin. Think about how this might apply to your own life. Having a personalized prescription can make all the difference. For cysts, whether sebaceous or pilar, dermatologists are expertly trained in their safe removal. As discussed, surgical excision is often the definitive treatment for symptomatic or growing cysts, ensuring the entire cyst wall is removed to prevent recurrence. If a cyst is infected, a dermatologist can drain it, prescribe oral antibiotics, and then plan for its complete removal once the infection has subsided. They can also provide injections of corticosteroids to reduce inflammation in problematic cysts. Moreover, regular skin checks with a dermatologist are absolutely vital for seniors. They can monitor existing skin lesions for any changes and detect new growths early, including those that might be cancerous. Early detection of skin cancers significantly improves treatment outcomes. This proactive approach not only addresses current skin concerns but also provides invaluable peace of mind, ensuring that your skin health is managed comprehensively and expertly as you age. Imagine the difference this could make, embracing a partnership with a skin expert who guides you through these changes with confidence and care. It's a simple truth, isn't it, that investing in professional dermatological care is an investment in your long-term skin health and overall well-being. As we've explored today, navigating the common skin changes that come with aging, such as the appearance of cysts and blackheads, isn't just a challenge. It's an invitation to cultivate resilience, embrace new possibilities, and truly live life to its fullest. By understanding the underlying reasons for these changes, proactively applying gentle yet effective home care strategies, optimizing our lifestyle choices, and knowing when to seek professional dermatological expertise, we empower ourselves to maintain skin comfort, clarity, and confidence. This journey of aging is continuous, filled with opportunities for growth and for refining our approach to self-care, ensuring that our outer appearance reflects the vibrant spirit within. If this discussion resonated with you, and you're ready to embrace aging as an adventure rather than an endpoint, then please take a moment to subscribe to Aging Gracefully 60. Your support helps us continue creating valuable content designed specifically for you. Hit that like button if you found this video helpful, and share it with anyone you know who could benefit from these insights. And as always, remember to leave your thoughts and experiences in the comments below. Your perspective enriches our entire community. Together, we can redefine what it means to age gracefully.